Let's talk about fetal assault laws in Tennessee and opioid use. First, let's talk about pregnancy and opioid use in Tennessee. Let's define those terms. Opioid use is the use of opioids, a type of drug, taken in a non-prescribed or illegal manner. This encompasses people who have substance use disorder and those who do not. According to current Tennessee law, pregnancy is the human female reproductive condition of having a living unborn child within her body throughout their entire embryonic and fetal stages of the unborn child, from fertilization to full gestation and childbirth. Some states have differing definitions on pregnancy. Here are the facts on opioid use. From 2017 to 2019, the yearly average prevalence of past year heroin use in Tennessee was 0.34% for ages 12 and older. When combined with prescription pain reliever misuse, like Vicodin, it climbs to 3.74% prevalence. So what is prevalence? Prevalence is the proportion of a population who have a specific characteristic in a given time period. For example, 29% of pregnant women enrolled in TennCare filled opioid prescriptions during 2009. That means that the prevalence for this group in 2009 was 29%. The use of opioids during pregnancy can lead to side effects, such as becoming ill, accidental death, and neonatal abstinence syndrome. NAS is when a fetus is exposed to opioids during pregnancy and then develops symptoms of opioid withdrawal, which makes them ill. What are fetal assault laws? These are laws that allow people who are pregnant to be criminally charged if they use certain substances, like opioids. This is different from normal laws around illegal substance use, because this allows prosecutors to use the excuse of child endangerment or neglect for the fetus. This law can also apply even if the substance the person is using is legal in their state. These laws vary per state. So for instance, in 2014, the fetal assault law in Tennessee became the first law in the United States to directly allow women to be prosecuted for drug use in pregnancy. There are some issues with fetal assault laws. People who are convicted under these laws often end up in jail, prison, or placed in inpatient drug rehabilitation programs. All of these consequences result in the eventual child being separated from their parents, either temporarily or permanently, and only 2 of Tennessee's 177 drug dependence treatment facilities provide prenatal care on site and allow older children to stay with their mothers. The fetal assault laws also corrode trust in medical institutions and limit the care that pregnant people could receive out of fear that drug tests could expose opioid use, leading to incarceration or family separation. These laws are not only limited by opioids, they also fall under cannabis use, methamphetamine use, and others. These substances can vary wildly in effects, but they are prosecuted under the same law. Here we have an individual example of someone who was prosecuted under a fetal assault law. This was done by the Marshall Project. Here are some recommendations. As we know, criminalizing substance use is not correlated with a significant decrease in rates of use. Methods that are known to decrease substance abuse include increasing educational rates, and decreasing poverty rates. It is recommended that fetal assault laws are replaced with the above prevention methods in combination with public health educational awareness on risks and resources for opioid use. What can you do as an individual? You can speak to your lawmaker about these laws and offer recommendations. You can give information on these laws to people at risk of pregnancy, and you can provide and distribute information on the risks of all these substances to all individuals.